And now, Dental Bites, with the dental hygienists of Dental Post.
Hello again, my friends. Happy to see you guys. Hey, a couple weeks ago, I was at a dental conference and I was talking with this company and they were showing their new device that they have out where they take a digital scan of a patient, create these trays, and put the gel in. And I've seen this over the years, and it seems like there's more and more companies, organizations that are developing these perio tray therapies, different kinds of tray therapies. I guess not even just for perio, but it can be used for so many other devices. And I'm just curious, for those of you who are still doing clinical, and actually for all of us, what do you know about them? What do you like about them? What are some of the things that you would like to know more about? I guess I don't know.
Yeah. For me, I would love. Sorry, Allie. I was just gonna say I don't have a lot of experience with perio trays. I'm hearing really great results, but I would love to know if anyone is using them in practice and the results that you are seeing.
Yeah, so we just implemented this in my office back in February. So we have currently maybe close to 10 patients using them for periodontal disease. So we haven't implemented it for, maintenance, routine, even gingivitis. We haven't really pushed it out, but patients who haven't responded as well as we would have liked with their deep scaling and non-surgical therapy. So I had really, really great results with patients actually doing the trays. I was nervous that they wouldn't wear them because initially they do need to wear them 3 times a day for 15 minutes a day. So I thought in my head, I'm thinking, oh, I'm asking them too much. Are they really going to do this? But every single one of my patients, actually, they definitely were compliant. They were excited about the results because they were able to see the change in their tissue. They've noticed less bleeding. They noticed less tenderness. They said it was easy. Like, well, I can do this, the water pick you wanted me to do, or the flossing. I hate flossing. Like this, I just put the peroxide gel in, place it in for 15 minutes, watch a show, and that's it. So I was really excited that I had good compliance.
So Allie, sorry to interrupt, but the tray that you're using, because I know there's a couple different kinds on the market, and some of them have like a reservoir that help push that solution a little bit deeper. Some don't. Do you know what the tray that you have, which kind you're using?
Yeah, the one I have has a reservoir. And when you do the 3D scan, you want to make sure you get at least 4 millimeters of the gingival tissue so that the tray goes down to the gums and actually pushes the gel into the sulcus of the gums and into where that bacteria is underneath. So yeah, that's kind of the key of actually getting that peroxide into the tissue and having it sit there and stay there for the 15 minutes.
Yeah, so you can't, like with these trays, I actually wear these trays every day, guys. I personally throw them in every morning when I'm in the shower, and I don't have gingivitis and I don't have perio, but darn it all, I don't want it. And so I wear them every day. And the way that this works, this gel, it's a 1.7% peroxide gel, but it must be done in these specific FDA approved trays. This is a medical device. And it can't, like, you can't make your own whitening tray because that's just going to smush out, like, right? You get some on the teeth, but it doesn't go under the gums. And the way that the tray works, at least the one that I'm using the one by Perio Protect, and the one that I'm using, the way that it works, because that's the only FDA approved one, is it pushes that gel below the gums, and it makes that area that is anaerobic, right? It makes it aerobic, like it brings in oxygen, and so those anaerobic bacteria, those guys that don't like oxygen, they're like, no, and it actually like it takes their cell wall and it just like obliterates their cell wall, and then they die. And then it has 2 side effects, though, I want to warn you about. One is it whitens your teeth.
Oh, what? No.
So for all those patients,
that's not why I came in. I didn't come in because I wanted white teeth. I came in because I was concerned.
Because I want you to treat my periodontal disease. And then the other one that it denatures calculus, because calculus is a protein, right? It's a protein, all layers up. Well, the peroxide actually kind of denatures that cell wall, and it actually makes the calculus like crumblier. Have you found that, Allie? Like when you're scaling, now that you're 3 to 6 months, I mean, you see a difference in that calculus. So not only are you then helping that bleeding, right? You're helping the periodontal disease. Oh, you're whitening the teeth, and you're denaturing the calculus. And when you get to a point, Allie, certainly, when you start, you wear it for 3 times a day or 2 times a day. But when you get to maintenance, you're at 1 time a day. And that's simple. Like my mom wears hers at night. And she actually, it has maybe a whole nother side effect. She's like, I can't drink that extra glass of wine at night because I put it in my trays and it's helping me lose some weight. So that's why she likes her trays. So
all amazing side effects I'm
like
hearing.
when we go to the clear aligners, right? You're like,
right?
Oh.
Right? So, but again, this is different than your clear aligners. You can't just throw this gel into your clear aligners because it's not going to push under the gum. We need it to go into the pocket. We needed to get to that anaerobic bacteria because we want to get that out because we know where all that leads us to, right? We know it leads to our brain and our heart and all the things, right? And so this is a really great, easy way to help patients be healthier. And one way I've seen it used recently, a friend of mine, they had a patient come in, and I think this was genius. They had a patient that came in that was on her oncologist had referred her to the dentist. She was undergoing chemo. And her oral care, I mean, she was a mess, right? Mouth was a mess. And so the oncologist was like, you really need to go to the dentist. And so instead of treating her right away, I mean, she definitely needed periotherapy. Instead of going right into periotherapy, they went into Perio Protect trays. And they did that for 3 months. And what they did, and to see the pictures of the tissues in that 3 months without any scaling, no one picked up a scaler. No one picked up a laser. No one did anything. But the tissues got so much healthier, so much less bleeding. And so then you think now when they went in finally to do non-surgical periodontal therapy, how much less burden were they then, releasing into that already immunocompromised body. So she was that much healthier to then get the treatment that she needed. And I think that is also a really interesting way to think about how to use this kind of therapy. So when you have that patient that, maybe does have something else going on, but then really, I think it's a cool way to kind of use this product. So I think it has a lot of uses.
Yeah.
I like it.
I think that's one of the key items that you've kind of been saying over and over with having the tray that holds it and pushes it is literally the holding of it, the sensitivity of it. It's not something you just put on your toothbrush, brush around and spit out. It actually has to sit and take time because it has to activate and do its job. And then it starts to dissipate and go away. So it's not just a set it on and rinse your mouth and go. You actually, it has to be able to stay there and hold on into that space for a while. And I think that's another critical aspect about tray therapy that we have to understand, that it is the gel and the tray together. It's not just the tray. It's not just the gel. It's the two coming together, working simultaneously for that positive result.
Yeah, absolutely. I think you hit the nail on the head, Tina.
Yes, thanks. At least I can hit something on the head. I'm always asking other people to hang my pictures. I end up hitting the wall instead of the nail. Oh, well, you guys, thank you so much for having this conversation. And I just, that's one of the cool things about going to conferences, right? Is seeing more companies doing new and inventive things within healthcare, and seeing other dental professionals doing new and inventive things, like a hygienist that says, hey, I think I want to have a tray that's going to help my patients out, right? Which the product that you were talking about, wasn't that invented by a hygienist?
No, it was invented by a dentist, actually.
Oh, okay. Well, still,
yes.
I think it's still very, very
it's still
neat.
super cool.
Still super cool. So I appreciate you guys sharing your bites of knowledge with me on that topic as well. And I just have to say that for anybody that listens to our conversations that we have here, please also do us a favor and subscribe to the Dental Bites podcast on any of your listening devices, whether it's, YouTube, Spotify, Apple Play, all the different, we know all those things, because we have fun. We have a lot of fun coming and talking to you all about these different things. And we want to be able to continue that. And in order to do so, we need your support. So continue to like us, please.
Yes,
please.
And let us know what topics you want us to talk about too.
Yeah,
yes,
Allie.
Absolutely. Thank you, Allie. Good. All right, friends. See you later. Bye-bye.
See you later. Bye.